You're listening to the Public Health Epidemiology Careers Podcast, episode 161.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. On this episode, you'll meet Christina Haswood and learn about her journey into public health from her Navajo heritage and culture to her public health work in policy research and politics with the state of Kansas. I found out during the interview that Christina has been a longtime listener of the podcast. And in fact, she listened to the podcast throughout her entire MPH journey. It wasn't until I started the sponsored episodes with the Tribal Epidemiology Centers that she reached out to me and started engaging across social media. She was so excited when I first started those sponsored episodes. When she reached out to me, she let me know that it really meant a lot to her to hear them. And at that time, I still didn't realize that I had traveled along her whole MPH journey with her. Well, I'm going to tell you more about Christina in just a moment, but right now, I would like to say a very special thank you to Gabriella, and I'd like to read an awesome review that she recently submitted in Apple Podcasts. Gabriella wrote, "I am a fan of this podcast and have been since February of 2019. I'm so glad that I found this amazing public health career podcast during my undergraduate internship when I didn't know what I was supposed to be doing after graduation." Well, if you're seeking direction on which path to take and you think the power of networking is unreal, then you must listen to this podcast. Dr. Huntley gives you the step-by-step for any student to reach their public health goal. Thank you so much for that review, Gabriella. I really appreciate you taking the time to do that. It not only encourages new listeners of the podcast to tune into the episodes, but it also encourages me to continue to provide this content every week. Well, now let me tell you more about my guest on this episode. Christina Haswood is a public health professional and candidate for the Kansas House of Representatives in District 10. Christina is a lifelong resident of District 10, which is located in the southeast part of Douglas County, including Lawrence and Baldwin City, Kansas. She is also a member of the Navajo Nation, and if elected, she would be just the third Native American in Kansas history to be in state legislature. During her candidacy, she expressed how her public health expertise is needed during this unprecedented time. With health policy issues facing the state of Kansas, such as COVID-19 response, expanding Medicaid, reproductive rights, and protecting Mother Earth, Christina is ready to listen to public health expertise as well as provide it. She has widespread support by endorsements from many organizations such as Emily's List, the Kansas National Education Association, the Sunrise Movement of Lawrence, Kansas, the Kansas Sierra Club, 7 current Kansas state legislators, as well as former Governor Kathleen Sebelius and current Congresswoman Deb Haaland. Christina won her 3-way Democratic primary with 70.72% of the votes and is currently running unopposed for the general election. She is qualified and ready to use her education, passion, and experiences to serve the community that raised her. Now, before I connect the interview, which you will absolutely love, I'd like to share a very special announcement. Are you curious about public health consulting? Have you ever wondered what it's like? What do they do? How do consultants get started? Learn what it's like to be a public health consultant by attending the Expo. The Expo is an online event where a select panel of public health consultants and entrepreneurs who are passionate about the needs they address and the populations they serve come together and share their businesses. Attending the Expo is very affordable and convenient because it's available online. Learn about public health consulting from public health consultants who do it every day. Visit drchuntley.com and click on the Expo tab from the main menu to register and attend the Expo. So I'm excited to introduce you all to my guest on this episode, Christina Haswood. So Christina, welcome to the podcast.
Thank you for having me. I'm excited to be here.
Oh, this is good. I'm looking forward to this conversation. So let's just start with you telling us a little bit about yourself.
Yeah, my name is Christina Haswood. I've heard a couple of other natives on the podcast introduce themselves in their indigenous language, so we'll try to do that. She'e Christina Haswood, Yinishe, Tora Chitni Nishan, the Beth Legend, Bashash Tina, Ejatabahan, Dashache, Ki Ania Chanela. I am Bitterwater, born for the Black Sheep. My maternal grandparents are the Zuni Edgewater. My paternal grandparents are the Towering House people. I'm originally from Inscription House, Arizona, Beacon, Arizona, but born and raised here in Lawrence, Kansas. I am a candidate for the Kansas House of Representatives in District 10, which covers the southeast of Douglas County, Lawrence, Kansas, down into Baldwin City. And I am just so excited to be here. And that's a little bit of who I am right now.
Oh, I love that. I'm really happy that you did that too. I'm learning so much about Native American culture. It's just exciting whenever I hear the introductions in the native language. So thank you for doing that.
Yeah, of course.
So let's go back a bit because I really want to know about your journey. So let's go back to when you first became interested in public health as a career. Can you tell us about that?
Yeah, this was quite a journey. I've always had this interest of health and basically saving lives. And health has always been an importance to me growing up as an Indigenous woman. And our entire culture is in relation with living beings on Mother Earth. And that's how I was raised. Not only to respect my body, but for the land. And, when you're a kid, you're always active. Like I did basketball before I could walk, actually. It was decided right when I was born, and the nurse was like, "Oh, you have long hands. You'd be a great piano player." My dad was like, "Nope, she's going to be a basketball player." And then I got into volleyball later on. I pretty much stopped growing at like sixth grade. I was 5'7", and after that, I kept that up. And then after high school, I thought I was going to play college basketball or volleyball. Tried out at Haskell Nations University where I started college, and I was supposed to be on the volleyball team, but I was just wanting to put academics first, and that's pretty much where my health started to decline. I gained the freshman 15, which was more like 30 pounds. And I was just out of balance everywhere. First time being away from home and just, doing everything that was just new to me, and the dining hall food and all that. But this word in Navajo, we call it hajo. And it basically is this one word that's five letters that says you're at peace and at a holistic peace with your mind, your body, your spirit, and the earth. And when I learned about this one word, it really put into perspective of what I'm trying to do. Oftentimes when we're trying to explain, something, we take a couple paragraphs to do it, but it's so strange that this one word kind of explains itself. And that's what I find a lot in my Navajo language is we say things less, but it means so much more. Pretty amazing. And also in high school, I wanted to be a nurse. I got to observe surgery when I was in my anatomy class in high school and thought it was fun. And I could take that type of workplace environment. I like to think because in my Navajo culture, we butcher sheep. So I've been exposed to that type of area. But when I took my first anatomy class in college, memorizing the bones and muscles was not fun for me. And that followed on into my undergrad at Arizona State University, where I failed that anatomy and physiology class 1 and 2, probably a collective of 6 times. And I even asked the program director, I was like, is there some way, aren't you guys tired of me being here? Oh my gosh. But I was just like, all right, medical school is just, not in the picture for me. But, one summer I buckled down and just got a C. And college really just taught me that, especially when I started college at Haskell Nations University, it's an all Native American college called TCU, Tribal College University. And it really showed, the first day of class in my Native American diabetes class, the instructor asked a question saying, how many of you know somebody or have known somebody who had diabetes, and the entire class raised their hand. And it was just a realization, growing up in a predominantly Caucasian town, finally at an all Native American school with other Natives around, that what I thought was just, oh, it's just my family that suffers from diabetes or high blood pressure. It was kind of the norm. It was uncommon. And then when I got into my higher education journey, it took me 6 years to finish undergrad, and I just graduated from grad school in May. So I've been in higher education for 8 years, and it just continues to show me, when we look at these statistics and we look at the data from CDC and we look at, our tribal and state data, that Native Americans are always the highest rates for potential life loss, mortality, morbidity. And then we can go into socioeconomic statuses and other social determinants of health, morbidity, suicide, high school dropout, obesity, poverty, unemployment, and the list keeps going on. And I just knew that my upbringing of being an urban Native came from privilege. I grew up going back to the reservation at least once a year, ever since I was born. So I saw the difference of my life and reservation life. And I never thought of it as a negative thing. I never thought that my grandparents were poor and in poverty, because every time we go back, it was so rich in culture, or we go and do a ceremony. It was more exciting for me. I knew we still don't have electricity. I think my grandparents just got running water about 10 years ago. They just got plumbing about 6 years ago. Those things didn't really occur to me that they were considered bad. But now, how do we fix this? And then we were faced with the whole United States government and, tribal sovereignty, and how do we navigate that, and adding more infrastructure to the reservation as well. So, and then, just to go more plainly into how I got into public health, it was actually my first internship, or not my first internship. I've done about 9 or 10 internships in my entire education journey. And I think it was about the third one, I signed up for the Summer Research Enhancement Program at Diné College in Sealy, Arizona. It's the Navajo Nation's college, one of two. And it came at a point in my life where I was just finished with high school, transferred to Arizona State University. And we did pretty much everything wrong, in the sense that I bought my textbooks at the bookstore full price. We didn't know how to navigate the loan system too, and we took out like the max loan that was recommended to us. And I went with like 2 suitcases. I only knew one person, which was my cousin. So I didn't know anybody from my town or from school. And I ended up failing my first semester over at ASU. And that was just, when I graduated high school with my Associates of Science, I graduated with a 3.6 cum laude. And, doing this 180 at Arizona State was really just, do I want to stay down, or do I fight to get back up? So when I got into this internship, luckily they didn't ask for my GPA. And, we stayed on the reservation for the summer, and majority of them, I think I was the only one that wasn't from the reservation, but I had family in Window Rock, which is the capital of Navajo Nation. And that's what got me my externship at Navajo Nation Epidemiology Center, and just learning public health. That's how public health was truly introduced to me. But it was introduced to me with the Navajo knowledge system that Diné College has created. Just like the learning and the style of learning, it was all charted, but in Navajo words, and explained to you in that indigenous language. We even started the internship with a blessing from the medicine man. And, this internship really started the way for me to public health, really understood how public health parallels and works well with indigenous ideologies. I always find it a little funny that we teach holistic health in textbooks, but it was something that we've always done forever. It just got a word to it. And always pioneering that and making sure that we do things in this holistic manner, not only for us indigenous peoples, but for other people as well.
Oh, that's really good. I mean, I really can appreciate your story. Thank you for really, for taking the time and kind of guiding us through this journey, because, You highlighted so many different experiences that are so relevant to public health. Your experience when you understood that, like you said, you talk about privilege, for example, you talk about being in a predominantly Caucasian community and thinking that it was just sort of odd or unique, some of the health disparities and issues or health problems that you were experiencing that you saw. But then when you were with the Navajo people and everyone's raising their hands, you realize, oh, wait a minute, everybody's got this. It's something's not right here. Something's different. So you've got a lot of public health in your experiences as you were growing up, and just your understanding little light bulb moments throughout, even before you had a title of public health on it. You were living a lot of public health experiences.
Yeah, definitely.
I also like how, you talk about the holistic approach and how, that's really what you've always been doing, with the Navajo people and indigenous people. You've always been doing that. It just didn't have the holistic name on it. It's, calling it something else. So I think that's really interesting too.
Yeah, I think even in the diagrams too, they do like the medicine wheel. It's not a Navajo thing, but it's a Northern Plains indigenous concept. And that's the best way I learned how to explain it. Best way I've learned it, the best way I explain it to others of, you have this circle and you break it down into 4 equal pieces. And it's just this continuous cycle. And, if one piece is not fully there and good harmony and spirit, the circle doesn't really continue and flow.
That's really rich. I like that. So tell me about, let's talk a little bit about some of your previous roles and how did some of the work that you historically done help prepare you for, what you are currently doing? I'm excited to kind of move into your work in the political arena and all of that.
Yeah.
And I don't want to jump ahead too far, but
yeah.
So why don't you just kind of do that? Talk to us about how your previous roles help prepare you for, and transition you into what you're doing now.
So again, I did about 9-10 internships in my whole higher education journey, mainly because I like to learn that way, being thrown into the environment and just learning hands-on. Another part of it was just, my bad GPA and just building up that resume. That's probably one of my biggest tips too. If you're not academically strong, experience is just as good too. And that really got me experience at all levels of government, from the Tribal Epidemiology Center to federal government agency when I interned at IHS in Rockville, Maryland. I even interned at the State Health Department in Arizona. Even did some working with data at the county level in Arizona, even at my university level when I was at Arizona State University, and I've done some work too at Haskell Nations University. And then I carry these experiences with me, and it was also just finding out where I knew I was interested in health policy, because when you look at an issue, and there's so many angles you can look at an issue. My research interest is in suicide in adolescents. And once you really get into why is this happening? One of the questions is, is data being collected? Is there federal funding? Why is Congress only allowing this much of federal funding? Or, why is this funding at potential loss from the White House? Why are they planning on not putting this in their budget? Once you get up to that high upstream approach of policy, that's where I started to get interested in health policy. And that was another level of change that really wasn't, I think public health doesn't really cover much of that. And it kind of steers you into the law school area, which I couldn't see myself practicing in a courtroom. And that was one of the questions that people would ask me when I was digging into law school. I was like, well, I don't see myself taking the bar. I want to continue research, and I want to, bring more natives into the university levels and getting masters. So they're like, okay, well, you should stick onto this side of public health. But other roles I've had, I think I've worked, at several research places. And most recently, during grad school, I was working at the University of Kansas Medical Center at the Center for American Indian Community Health. And they worked in partnership with American Indian Health Research Education and Alliance. But that really, I've actually interned with them twice, one as an undergrad and one in grad school. And they really got to see my progression from being just a little undergrad public health major, working on these projects. And then I actually got to see some of these projects kind of wrap up and into their paper submissions and publication stages into the research, which was really nice. But over there, I actually got hands-on experience of creating surveys, doing some basic frequency statistics, and helping them with their papers and that such. I also learned in grad school that I don't like data analysis. And what do we use? SAS? Oh man, I thought I was going to throw the computer out the window. That was not fun. But I was on the management track, so I just had to get a basic understanding of it. But yeah, and then also during my internship there at my last year in grad school, I got to help with their most recent. It was called Knowledge, Attitudes, Beliefs, and Behaviors Surrounding Alternative Tobacco Use in American Indian College Students. And we really wanted to look at what electronic cigarettes like Juul and Joy were impacting Native Americans, because here in the Midwest area of Kansas, we still have high tobacco rates within Native Americans, and we want to see how that would affect the younger college age population. So we did get to start this research at one of the local colleges and see how it was impacting Native students more differently or similar to how the general population of high schoolers and college kids were impacting by that current epidemic. It was just a great experience, and I'm the first in both of my sides of my family to go to grad school, and the other researchers there was about 3 or 4 that are Native that went through the MPH program, and they were more than happy to mentor me. And it was always great because I would go to class and then I would go back to the center for my part-time job, and I would just reflect on the style of teaching there and what they're teaching. I think I've only had like a handful of classes that touched on tribal sovereignty when we talk about the healthcare systems. It always seems like an afterthought, and especially we would get a lot of guest lecturers that would talk about the healthcare systems, and I'd ask about, what are you doing with improving Native American population health? And they wouldn't really know what to say. And I've also experienced, I guess you would call microaggressions, or maybe just plain out racism in the classroom. I did have an experience where one of the guest lecturers, he was a director of a public health department. So he was talking about public health accreditation. And I asked, he had, I think, one tribe that had a public health accreditation. And I was like, okay, what are they doing to get more tribes? Because, tribal health centers and Indian health services aren't known to have the most high quality health services. I think this is great that we can set a standard and a goal for tribes to meet, as well as urban Indian health programs and health organizations. We always talk about tribal, but 70% of us live off the reservation. And he was like, oh, I don't know. Maybe I need to smoke the peace pipe with them and figure it out. So that happened in the classroom. And I was just taken back that, at this high level of education, with such a leader in the area saying something like that to me. And I actually reached out to, we had a women of color support group at the school, and it was women facing some type of discrimination in the classroom at the medical center. And we got together once a week and had this safe space of sharing similar stories. So that was an eye-opener.
Yeah, that's awful. I I don't even know what to say about that because, we hear the stories all the time. We live the stories, as a Black woman, definitely have my fair share. And then I have a daughter who's in college, and I hear my fair share of, stories from her and her experiences and her friends. I'm really happy that you had that support group. I think that's really important to have, like you said, those safe spaces to be able to talk about it and then figure out what your next steps are going to be.
Yeah, to talk about it. But I think we all share these similar experiences, but we don't know what to do when it happens. And that's the biggest thing that I found for myself too. And I continue to work at it is when someone says, something that's inappropriate, to correct them, to find that strength in yourself to say, this is not okay thing to say. You can say this instead. But I think when we all are young, I'm 26, so I'm fairly young. I'm just trying to figure, the most appropriate way to correct people, especially in this higher educational world and, the future that I'm going into. I can't, say what the first thing comes to my mind.
Yeah. I appreciate that. And thank you for sharing that. That's not an easy thing to talk about, but I do appreciate you being very open and willing to share on such this level of transparency, because I know that it's going to touch and help a lot of our listeners.
Yeah, of course.
Okay, so I'd like for you to if you would just talk for, just briefly tell us about your work in the political arena, because we realize, we hear from you and kind of listening to you, I realize, I can understand why you're so passionate about, health policy. So tell us a little bit about where that has led you in terms of your run in political arena.
Yeah, I think I didn't wrap up much on my professional, but after KUMC, I'm currently working with the University of Kansas on their COVID-19 response. But simultaneously, as a candidate for the Kansas House of Representatives in District 10, I guess just how I got into this political journey, it pretty much came from a class assignment in grad school where it was public health, law, and policy. And I was extremely excited for this class, and it was a little disappointed. It was only one class, and it wasn't a track that I could focus on. The instructor asked, who's your state representative and who are the leadership in the state house? And I've always been more focused on federal because of working American Indian Alaska Native health policy. That's all done at the federal level. Last summer, I was interning in D.C., and I would go to the Hill and meet with congressmen and women and their staffers to advocate on American Indian health policies, not only for Navajo Nation, but for the state of Kansas, and just seeing what they're doing, focusing on urban American Indians as well. Also in my district is Haskell Nations University, which is ran by the federal government, and seeing, what are they doing to improve the school there. And being Native, I got my health care from Indian Health Services, which is ran by the federal government as well, seeing how we can improve that health services and systems. So with all that, I was interested, with this, what does the state of Kansas do, and what are their powers and limitations into improving my population's health? So I identified who my state representative was. Her name's Representative Eileen Horn, and she would have Saturday morning coffee talks. And also my state senator, I went to one of his sessions, State Senator Tom Holland. And I was very pleased to know that Representative Horn was very knowledgeable, very compassionate. Every time I encountered her and asked her about Native peoples and our questions, she would admit that she didn't know much, but she always invited me for a conversation on that. That was a pleasant surprise, and I really wasn't met with the same kindness at the federal level with my congressmen and my state senators there. But it really showed just, how, I guess, down to earth these people are at the state legislature. And then last February, Representative Ponkalee Victors from Wichita State Representative, she was introducing a missing murdered Indigenous women's bill. And this is one of the epidemics that we face here in North America, including Canada. Our Indigenous women, it even extends to Indigenous men too on the Navajo Nation. A lot of Navajo men and boys go missing too, and our elders sometimes. And Kansas is in the middle of the country, so I haven't seen data on any human trafficking, but I think it's not being collected at all. And when we introduce these types of legislation, maybe that'll help correct it. But she was introducing this bill at the state house, and I think I talked to her the other day, and it was during a blizzard, actually. And I went to Topeka just to witness history, to see her introduce this bill. And when she asked us to wear red, because that's the color of spreading the awareness of missing Indigenous women. And then when we all got there, she asked us to stand behind her, because this is for our aunts and for those who have sisters and grandmothers. But not only that, but for the future generations. It could be my future daughter that this bill helps out, and my future grandkids. So it was really symbolic, and it was just amazing just to see that happen. And that really made politics for me in the future a reality, because I always thought that being brown in Kansas wasn't the perfect formula for me being a politician here. I always thought I would have to go back to Arizona or tribal politics. And it really wasn't until when I saw Congresswoman Sharice Davids win here in Kansas in Congressional District 3, I was just like, wow, we can do it. we do belong here. And, it was just eye-opening for me to see that. And those couple of experiences as well Congresswoman Deb Haaland and the other Native American woman first in Congress, it was just really inspiring to see. And I'm a big person on representation matters. Seeing them be in those positions really made it a reality for me, because last year I was at a conference and we were talking Ignite Nation. It was an all-female conference empowering women to go into politics of all parties. And we would kind of laugh and giggle like, oh man, do you think I would run one day? Oh no, that's crazy. We're young. We're in our early 20s, or I'm not anymore. But it was just kind of like, one day, you think we can run for Congress? Oh, not now. We got to finish grad school. But then, next summer here, I'm running as a state legislature. So it was just, putting these experiences and seeing other Native women in these positions really just made it a reality for me. And I really hope that I carry that on to younger girls of color, other brown girls, Indigenous girls. And I think we've done a pretty good job so far, especially with TikTok. We've gone viral a couple times, and we've had people reach out. I've had a girl email me, my campaign email from South Korea, asking how she can get involved with my campaign. And I was just like, wow. Like, I don't know how, but it was just amazing. And I think we got some comments on TikTok from people in Australia, New Zealand. So I just really want to be that representation for those. And we need more people of color in these positions, these elected leadership positions, especially now with the disparities of racial disparities in our criminal justice systems, with the murder of George Floyd. And, these solutions are disproportionately affecting us people of color. And, we're doing a good job of advocating and protesting, but we also need more of us up in these leadership positions, creating the laws and making sure that they have the best interests going forward.
Absolutely. Absolutely. Great points in there. I'm just going to say, I agree with you. I agree with you. Absolutely. I'm enjoying this conversation, and I could talk to you all day about this. I love your story. I love the work that you're doing. You've got my vote, even though I don't even live in your state. I told you that when I first saw that you were running, like, you've got my vote.
Yeah.
So I'm excited to see just where you go from here. Really, it's inspiring. I'm glad to hear that you are just, moving forward, taking big steps. And it takes a lot of courage. So hats off to you. I wish you all the best on these, these big goals that you have.
Thank you.
We need people like you in office. Absolutely do.
Yeah, and definitely like when I first got asked to run, it was extremely intimidating. But I heard great quotes saying, the first step you take doesn't have to be planned. You just got to take that first step. That's pretty much what I did.
That's right. That's absolutely right.
Yeah.
That's absolutely right. So I look forward to following your journey. All right. So Christina, I'm going to transition a little bit and ask you a couple of questions as we kind of begin to wrap up, because like I said, we could be talking forever on this, and I would absolutely enjoy it. So you listen to the podcast for a while, and you understand that we have a lot of students who listen to the podcast, and then we have a lot of graduates, recent graduates who are interested in careers in public health, but maybe you're having a little trouble getting started, in that direction. So let's first think about students. And I'd like for you to share some tips for students who are currently enrolled and working on their degree, but who are, want to have careers in public health.
Yeah. Well, I think, the first tip would definitely be listen to this podcast.
Yeah.
I started listening to your podcast, I think, when I started grad school or when I was looking into grad. Oh, it was before in undergrad when I wanted to go to grad school and I didn't know how to do it or do the GRE. Like I said, I was the first in my family to go to grad school. So I found this podcast and, I hope I could be of help to those who are in a similar situation. And, my University of Kansas Medical Center, I live in Lawrence. It's about a 45-minute commute there and back. So
awesome. See, I didn't even know you had been listening for that long. So I basically went to school with you.
Yeah, you basically were. My mentor all the way through.
Awesome.
Yeah, we made it. But yeah, the second tip I would definitely say is if you don't know what you want to specialize in, I know a lot of people will ask you, what are you want to specialize in public health? What was your research topic? Do a lot of internships. That's how, I got to what I knew what I wanted to do. I've always said I wanted to go into American Indian federal health policy since I was an undergrad. And that really saved some time for me when I was filling out scholarships and looking at internships. And that was, I think people are fairly impressed too when you know what to do. But if you still don't know, that's great. You have a big heart and you just want to help. I think all of us in public health just want to help people. And, internships are a safe environment for you to fail, but also a great environment for you to thrive in. And you can also volunteer and shadow other health professionals. During my undergraduate, I would contact people at the health department because that's what I thought I wanted to do at the time. I would do professional interviews with them. I come in with about 5-10 questions for them, sit down with them for about 30 minutes in their office and ask just basically, how did you get to where you are today? And I found out that people love to talk about themselves. So not only will you usually use your student status, but they would love to help you and they would love to just tell how awesome they are. And also just tell everybody what you want to do after school or what you want to do. Just tell everybody, tell the world, even give your elevator pitch too, work on that. I got it down in politics, it's called a stump speech. And, this is a current thing. People have short attention spans. So the more you can hit the high points and brag about yourself, that's great. Also bragging about yourself gets some time to get used to, but don't be shy. Be proud of yourself and your accomplishments and being where you are today. Again, use your student status everywhere. And always email people to ask if there's a waiver for students or a travel scholarship. That's how I got my grad school application fee waived. I was like, you guys got a waiver? Because we are broke at that time. And network with professionals, with your peers, everybody else. Share your personal experiences. It's valuable. And never be sorry for speaking out and bringing up issues that makes others uncomfortable. I've always, in the classroom, was that one native or a couple natives in the classroom that would bring up I would say the most simplest question I ask pretty much anywhere in conjunction to Native health is, what about us? What are you doing for Native Americans? And that's usually, 9 times out of 10, I know they're going to say, I don't know, but they're going to remember that you asked that question. And sometimes I like to be dramatic and stand up and ask my questions so everybody in the room can see me. But yeah, just be confident, because, something like that, for me, being Navajo Indigenous person, it's something I've lived through my entire life. My ancestors survived genocide for me to be here. It's something that was before me, currently me, and something that's going to be after me when I'm gone. So don't be shy. Be proud of who you are, and never say sorry too much. This is one thing that I always work on, is reserve that word for something you truly mean for it. And just find a group of people who you most simply vibe with. During my time at undergrad, I co-founded Arizona State University's first public health club, and we brought together students who were interested in public health. Public health was so new. I feel like it was just getting introduced to a lot of universities within the past 5-10 years now. So this is a great safe space for us to meet, and also be, like I said, I found in grad school a woman of color support group. And it was really just a place where I could be myself. And I find these other places too, sometimes online, where I can just be my normal public health Christina Haswood self. And there's other spaces where I can be Christina Haswood, the politician, or Christina Haswood, the 26 young Native girl who likes fashion. Find these safe spaces for you to just be that part of you and just feel comfortable in.
Awesome tips. I love it. Everything. Really, really good. I'm taking notes here. I've got the notes you sent to me, but I'm taking extra notes. Powerful tips here. Let's think about the graduates now, because some are thinking, what about me? I've already graduated and I've already suffered through, and I did most of those things wrong. What can I do?
That's okay. Yeah. I would say get your foot in the door by volunteering, internships, fellowships, part-time, temporary worker, and always tell them the position you're willing to work up to. That's kind of how I got involved in politics. I started volunteering, getting people registered to vote during November. I volunteered with that, and I started to volunteer. I did a couple weeks for Congresswoman Sharice Davis's campaign. Just volunteering your time, and people will start to really notice you too. And everyone wants to help you as well. Go beyond the definition of public health, the job in the workplace. I know the textbook will give you public health jobs, but there's so much more that public health can go into. And now is the time to be gentle with yourself as well. Allow yourself to explore other opportunities. I like to share the story that one of my classmates in grad school, she was a hairstylist. She went to cosmetology school, and she was concerned with the work conditions of all the chemicals that they were working with, and the air quality, and the type of breaks that they get, and how they get so personal with clients that they don't have mental health training or protocol to report things like suicide behaviors or domestic violence. And she came in with that passion, and that's not a typical public health path to go to. So always broaden. Public health can be squeezed into pretty much anything I believe in. And also now in a world of technology, you can start your podcast or your blog or YouTube channel, TikTok, website. This is a great time to branch out into those other things. And, once maybe the world gets a little bit better and you can go back to applying for jobs and getting back into the public health, you can always leave public health and come back. And I know politics too there really isn't, I haven't read a textbook that said, after your MPH, you can be a politician. I see a lot of people too with MPH at the end of their name, and they're doing, amazing things. And, if you don't get it the first time, try again. But after that, maybe now is not the right time for that opportunity. And this comes from my personal experience when I did my internship last year with the Native American Political Leadership Program. I actually applied the year before. I got rejected. I was mad. I was butthurt, and I contacted them and said, I am amazing. I am qualified for this internship. Why did you not pick me? And they were like, well, we think your resume would need some good work. So I mustered up a couple of my checks for my part-time jobs. I started working at Domino's too in undergrad, and I flew myself out to DC and met with them, and they helped me with my resume, and they connected me to other directors and workers in the Native American health policy area. And that's where I ended up getting my internship at the National Council of Urban Indian Health. And, maybe that first time that I got rejected wasn't the right time for me to be there. And, just how things ended up working out for me since the summer. Timing is, I guess, everything. And I guess, just another piece of advice is to be kind to yourself and to others. We're in an unprecedented time, and everyone's stress is at an all-time high, and you are a public health professional, so you need to walk the talk.
That's right.
And, what you say about good health practices, and encourage others to do that as well.
Absolutely.
Even this morning, I went to the gym at 6 a.m. because that's what we always say, get your exercise in and drink water. And yeah, you can lead by example.
Absolutely.
Yeah, if anyone else has any more questions, feel free to contact me. I am pretty accessible, and I would just love to help you.
Okay, perfect. I'm going to be sharing your contact information. Well, I have it all on the show notes page for this episode. Right now, I just want to say thank you. This has been amazing. All the tips that you just shared, I'm just going to say 100% agree. Very powerful. I love the story, the action taking, just everything that you have to say. That's just wonderful. I hope everyone listening is taking notes. Maybe there's at least, if you take one of the little gold nuggets that she's dropped in this episode and run with it, then you're going to be so much farther ahead of the game. So Thank you. I've really enjoyed this conversation with you. And I can't wait to see the election results and all the amazing work that you're going to do. And I know we're going to keep in touch. So that's going to be really awesome. So thank you so much for being here.
Thank you. Yeah, thank you for having me.
Well, I hope you enjoyed that interview with Christina. I'd like to thank her for coming on the podcast and sharing her career journey, and for those great career tips for everyone as well. If you'd like to connect with Christina, then just visit the show notes page for this episode, and that's where you'll find all the links to connect with her. And this is episode 161. So if you go directly to drchuntley.com, and that's drchhuntley.com, click on podcast from the main menu, and from there, just navigate to episode 161, and you'll find all the links to connect with her. Also, if you are enjoying these podcast episodes, then please take a moment and write a favorable review in Apple Podcasts. Your review really does help our show rank higher on the iTunes charts, which makes it much easier for others to find the podcast. It also encourages me to continue to do this work. Thank you in advance. I really do appreciate the effort. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.